On to another module activity. And this one you're going to become more interactive with us on this one here. Okay, this is medication usage. We need chart 20. And what we're telling you here is you got to remember, we're not doctors and we're not pharmacists. We're just passing on information, believe me. You know, and just a stat is 10% of all of the emergency calls in Canada is due to misuse of medications. 10%, that's over 1 million people, are going to the emergency rooms from misuse of medications. And that can be for several different reasons. They can mix them, they can have too many and not know when to take them. There's all kinds of different reasons. So the purposes of medications is to relieve the symptoms. That's number one, such as inhalers or pain medications. Prevent further problems, such as diuretics, blood thinners to prevent stroke. Improve the disease or slow its progress, such as some heart medications and drugs for osteoporosis. Replace substances body normally produces, such as insulin and thyroid. So those are some of the purposes of medication. There can be others as well. Unfortunately, while medications can be very helpful, they also have a downside. Some of the problems with medication include such effects as 21. They may have no noticeable effects. When you think the medication is not working because the symptoms don't change, this may be due to the medication is working, but the symptoms don't change. So it could be working. Or the medication is working, but you feel the same. That happens as well. Or the medication hasn't started to work yet. Because some medications you take don't start right away. It's a progressive thing. And medication just isn't working. I've heard that statement so many times, I've forgotten it. But just because it's not working right now, don't stop taking it until you talk to your physician. Because you may think it's not working, but it could be. Okay? And some of the negative effects of it is the allergies. Dangerous and need immediate reporting. That if you they are usually easy to spot. You may develop a skin rash, hives, swelling, wheezing, not breathing normally. But when that happens, you should stop taking the medication right away and talk to your physician. And you have some side effects. And the side effects are annoying and unwanted, but mostly are not dangerous. Some are, but most are not. Most common is nausea, constipation, diarrhea, dizziness, sleeplessness, etc. But if you're having problems because of side effects, talk to your physician. Don't stop taking the medication until you talk to your physician. But on the other hand, if it's an allergy, stop taking it right away. 22. And if you're having trouble taking your medications, that's also in here as well. It tells you how to try to overcome that. Page 239. Medication responsibilities. And you inform all your healthcare providers of all medications and dosage. And that is all. Not just some. That's your pharmacist, your doctor. And when I say all medications, that includes like any over-the-counter medications that you may be taking. Because some people take vitamin C or whatever. You have to tell people that. A good way to keep your record, if I can find it in here, File of Life. Most of you know what that is. You can get them at any pharmacy. They come in two different sizes. This is the large size. They also come in about half that size. And inside is a card that you can fill out all your medications that you're taking. You can get half a dozen of these if you want to. You can keep one in your car, one in your house, carry one in your purse. But you should list all your medications, including over-the-counter medications. And if you're leaving it in the house, you leave it in your fridge. That's where all your first responders are going to look. If you've got a File of Life, they're going to look in your fridge first. Because you may not be responsive. My advice is that anything you're taking, you list it. You make sure that everybody knows it. And the other thing is if you're traveling out of the country, you should have one of these to take with you. Because also on that, it gives all the information of, like who your doctor is, who your pharmacist is. It gives all that information in there. And also it gives you, if there's a care provider, it would list that person too. So that in case, like if you were unconscious, there's a care provider and a phone number that you can contact. Just some good information. And make and carry medication lists, which is just what I showed you. Like I say, those are free at the pharmacy, so you can get those anytime you want. I think the hospitals have them as well, if I'm not mistaken. And know why you're taking the medication and how to take it. A lot of people don't ask the doctor, why am I taking this medication? And if the doctor, some people say, well, my doctor's not very communicative. Talk to your pharmacist. They actually know as much as anybody about medications. So they can tell you, they can say, well, you must have diabetes if you're taking this medication. And you say, no, I just got a heart problem. Well, there's a problem there. So report the effects of all your medication, and if you're not taking it as prescribed. So when you go to your doctor, if you are not having any effects, or if you are having effects, you should tell your doctor what effects you're having or not having. And use medications as prescribed. And when I say that, that means don't cut your pills in half, don't take somebody else's pills, and use your mind. As we keep saying, the mind is very powerful. Use positive thinking and imagery to imagine your medicine is working well. You can tell yourself in your mind, hey, my medicine's working great. I can run a mile a day. For some homework, and it's strictly your own choice, for some homework, we suggest that you complete a personal medication list. And that should include the names of all your medications, the provider who prescribed it, the dosage, the date started, the reason for taking it, and any allergies. That's a lot, but it should be all there. Yeah. Particularly if you're traveling away, because the more information you have, the better. And when I say the list should also include all over-the-counter medications, herbs, vitamins, creams, ointments, eye drops, etc. Even eye drops should be there. We're going to go on to making informed treatment decisions. Now in this book here, Chapter 14 covers that entirely, of making informed treatment decisions. So making informed treatment decisions. We hear about new treatments, new drugs, nutritional supplements, and alternative treatments all the time. Since we know that chronic health problems seldom have a cure, it is easy to hope that these things will help us. We all want the magic bullet. Yeah. Unfortunately, it doesn't exist. Yep. So, we need chart 23 there. So we're evaluating our treatments. The first thing you got to do is say, where did I learn about this? My healthcare provider, scientific journal, supermarket tabloid, ad on TV, neighbor, flyer. You see them all the time advertised on TV. All these magic things. So where did I learn about it? Very important, And we're the people who got better like me. In other words, if somebody says, hey, I got better by taking this pill, I had fibromyalgia, but you've got diabetes. So how is that pill going to help you? Believe it or not, people do think it's going to. So we're the people who got better like me. Very important. Also, the age, the gender, the lifestyle too. That can be very important. And could anything else have caused these positive changes? Seasonal change, other medications, emotional change, stress levels, any of these. And does the treatment suggest stopping other medications or treatments? Does it eliminate any important nutrients or stress only a few nutrients that could be harmful to you? Very important. Can I think of any possible dangers or harm? You have to take that into consideration. Does the treatment suggest not eating certain foods? Big one. Can I afford it? I don't know if you ever look at a pharmacy. I do it more so now since I've been doing this course. But I look at some of the supposed over the over-the-counter medications that's supposed to help you. One that really surprised me, take a look and next time you go to the pharmacy on Lakota, for example. You hear it advertised all the time. Yeah. Take a look at the cost of it. A little bottle like that, 17 bucks. And that's just a little bottle. Yeah. Am I willing to go to the trouble and expense? Those are all things, when you're evaluating your treatments, these are all things that you should take into consideration. Every one of those. As I say, if you take the course, get the book, you'll find it all in there as well. And there are URL, to help you find more reliable sources, look at the author or the sponsor of the site and the URL addresses. There are URL addresses that are good. And those are, you know, like, if they end in .gov, because it's a government. Yep. EDU is education, such as the Stanford program. ORG, such as National Council of Aging, so .org. .gov, as I said. .ca is the country code for Canada. And .ca is complicated to secure for a website, so they know that any website ending in .ca has expanded effort to do so. .gc.ca is a public health agency. Those are some of the ones that are really good to go to if you're looking for things online.